So here's everything that we need for a crown prep, an inlay and an onlay. We have the treatment tray with a fast handpiece, a slow handpiece and a burr block. We have the alginate with the scoop. We have the mixing bowl and the spatula and the measuring cup. We have different types of trays. We have the sectional trays like these ones. So you've got the upper right and the lower left sectional tray, and then this one is the upper left and lower right sectional tray. For this size tray, you will need 1 scoop of the alginate and up to the level 1 scoop on the measuring cup. We then also have the full tray. So you've got the upper tray and the lower tray. You have a handle which goes that way on the lower tray and that way on the upper tray. You then have the tray adhesive, which you'd paint onto the tray base, so that's so the alginate could stick. For this size tray, you'd use 2 scoops of the alginate, 2 level scoops, and up to the 2 scoop marker on the measuring cup. We then have these scoops, which are for the putty. We've got 2 different types of putty. We've got the Proville Nova, okay, and we've got the Imprep AC. The Proville Nova is for the private patients and the Imprep is for the NHS. They both come as a catalyst and a base, which you need to mix together. So for this size tray, okay, you'd use, for this one, okay, so for the NHS, and it's half a scoop of each mixed together. For this size tray, you'd use this for the private patients, so the Proville Nova, and that's 1 scoop of each. We then have putty wash, which again we have 2 types. We've got the Proville Nova, which is for the private patients, and we have the Imprep AC, which is for the NHS patients. We then have the bite registration, and we have the structure or the temporary crown. This one is the Uno Temp SC, which is for the NHS patients, and this one is the Lux Temp, which we would use for the private patients. We then have a UV light and the UV light shield as well, which you will need to use alongside of the clip, which we use for the inlays and onlays. And we have the articulating paper. We've got the shade guide, which we use to check the shade for the crown. We then also have the needle holder, the anaesthetic. We have a long needle, which is used for the lower jaw for an ID block, and then we have the upper jaw uses the blue needle as well as the lower anterior. You may also need a cotton wool roll. We then have the lab dockets. Okay, NHS usually go to Chapel, private will either go to NV Creations or another lab. We have as well for the crown post preps, we have a box like this which lives in the decon room. It's got everything you need inside. It will have the drill bits there. Okay, these are in colour order. Okay, we've got the paracord there with the tip. You've got the rinse conditioner, and then A and B. And then we've got the mixing and the little mixing pot there as well as the actual posts which are in here. So all of this lives in the decon room. It all goes back into the box when done.